now starting. All attendees are in listen-only mode.
Hello, everyone. How are you? Tonight we're going to do our path to the USMLE Step talk. Welcome. My name is Tao Lee. I am a professor, associate clinical professor at University of Louisville. But you folks know me better as the editor for First Aid for the USMLE, and I'm also the founder and chief education officer for USMLE-Rx and USMLE-Rx. So that's our question banks, our flashcards, our videos, and our learning bricks, as some of you know them. So we're going to have a great talk tonight, talking about how to prepare for the USMLE. So hopefully we'll have a little fun tonight and learn something along the way. All right, so let me get to the next slide. This is the first word in first aid for the USMLE Step 1. This has actually been the first word in the book for over 30 years. And we've been very purposeful in using that word because we really think that you want to be very deliberate and calm as you prepare for the USMLE. This is the proverbial marathon, not a sprint. So you want to be able to pace yourself. And so we'll talk about how to deliberately and properly prepare for the exam. All right. Now, before we get too much further, we have a couple of fabulous folks on here tonight. We've got Louise and Kat, who are part of the USMLE-Rx, USMLE-Rx team. If there's simple questions about, hey, availability of bricks or question banks or costs and stuff like that, they'll be happy to answer it. Otherwise, questions about taking the exam, this, that, and the other, we'll keep those towards the very end. They'll keep track of what types of questions we have, and then we'll try to answer them towards the very end in the Q&A box. So that's it, and we will get going. Oh, sorry, let me see. Oh, wrong. Sorry, showing the wrong screen. All right, hopefully that's a little more focused. Nobody wants to see my 49-inch screen because you can't see anything. All right, and I will also open up the question box. So yeah, like I said, if you have questions, feel free to put them in there. And like I said, Louise and Kat will try to answer questions that they can. But otherwise, things about the actual boards, I will try to circle back on those questions afterwards. All right, let me adjust my screen a little bit, and we'll get going. Okay, great. So in this talk, we will review the basics. We'll talk about defining goals, timelines for studying, how to approach it, prep resources, some additional study tips. And at the very end, we do have a raffle. So a couple of you will walk away with a couple of very nice packages with our Q banks, bricks, flashcards, videos, and so forth. And also there is a back to school offer as well too. So hang in there, and you'll be able to potentially win a prize. And then, like I said, we'll answer some questions at the end. So I'm going to start off with a question here. I want to see, learn a little bit more about you folks. So I want to know who's out there. So you should be seeing a poll question, and it's going to ask who you are. So why don't you go ahead and provide an answer. I'll leave it open for about 10-15 seconds, and then we'll tally the results, and I'll share it with you all. All right, a couple more seconds. All right, I think we got enough results, so let me go ahead and share it with you all. So what we see here is the majority of the folks here are international graduates. And we do have some that are born in the United States, North America, and we also have some U.S. medical students as well too, both allopathic and osteopathic. So welcome. And then I do want to ask a separate question, which is, when do you plan on taking the USMLE Step 1? So is it before the end of the year, early next year, later next year? So go ahead and pick a best answer. So again, I will leave the poll open for about another 10-15 seconds. All right, looks like about 30, 40%, 50%, okay, getting higher, 60%. All right, looks like the majority of you folks have voted, so I'm gonna go ahead and close the poll. Share the results. So there's a chunk of you, there'll be about 30 of you will be taking it before the end of the year, another 40% by summer, and then the rest will be, as you can see here, after July, and there's be a handful that will be taking 25. A couple of folks haven't made up their mind yet, which is perfectly fine. All right, so so it's good to kind of see where the spread of folks are and when you plan to take the exam, right? So now let's talk about the basic of the exam itself. This is a one-day exam, 8 hours. It's pretty intense. It's 280 questions in 7 one-hour blocks, so 40 questions per block, and there's 45 minutes of break time. This is kind of a high-level schematic. The red block here is kind of the orientation block, and then you have the 7 blocks, and then at the very end there will be a survey. Somewhere in the middle, you see you're going to have lunch or break and so forth. One thing to keep in mind is that, excuse me, this orientation block is optional. This is the same block you'll get when you download the software off the USMLE.org site, and you'll only need to go into it at the test center to be able to adjust your headphones for the handful of multimedia questions, on the exam. All right, and so if you do that, you will. If you do that, you'll capture back some of that time because you're actually given 15 minutes to do that. So if you go in really quick, just adjust it, like say a minute, you'll get 14 minutes back, and so you'll have close to an hour of break time. And then I'll talk just a little bit about how you can get even more break time. All right, so with regards to the type of questions there's really only one type. It's called a single best answer. Now, there are some variations of that. A couple of them, as I mentioned earlier, will have multimedia. Some of them, almost all of them, will have scenario-based clinical vignettes, and the majority of them will have multi-step reasoning. So what does multi-step reasoning mean? It means that they'll integrate multiple logic steps that you need to solve to be able to answer, the question. So, so here's an example. A 32-year-old woman presents with a 5-day history of occasional double vision and bilateral ptosis. Then it goes on to ask, what is the most appropriate diagnostic test? So when you are trying to break this down, and we occasionally do these things called question dissection labs, when you're trying to tease apart what's going on, the first thing you need to figure out is, are you dealing with a single step or multi-step question? And you can clearly see that the first step is about diagnosis, right? You got a clinical scenario here, you're trying to figure out what's going on. And then the second step is, what is the most appropriate diagnostic test? So in order to get the most appropriate to come up with the most appropriate diagnosis, you got to figure out what is the most likely diagnosis. So in this case, with this woman who presents with occasional double vision and the droopy eyelids appears to be symmetrical, at least, because they don't say otherwise, it's likely going to be myasthenia gravis. You could make an argument for something like multiple sclerosis, especially if the findings are unilateral, in a younger woman. Okay, so that's an example of two-step question. Let's take a look at the interface itself. So it's quite simple. This is what you'll get when you're at the Prometric Testing Center. You obviously have your question here. We call that's the STEM because this is the scenario, and then here's the actual question, and that's also called the lead-in. You'll have typically 4 to 5 choices. The majority of the time will be 5 choices. Occasionally it'll be 6 or 7 choices, and then about 10 to 20% of the time you'll run into some sort of images, diagrams, or something like that. You'll have navigation across the top. navigation across the side. You have your block time, you have your timer for the block and also for the rest of the day. You have the ability to lock the exam, say when you need to go use the restroom or something like that, but the timer will keep running. You can you can change any of the answers while you're within the block, but as soon as you hit end block, you cannot go back into that block. And the other thing to note is that if you finish the block with some time left on the timer, then it goes, it remains in your daytime remaining, and that basically becomes more break time. Okay, so scores and passing rates. As we all know, USMLE now is pass-fail. Now, there is a number behind the scenes, which is 196 on a 3-digit scale. They're not going to show that to you, but that's what they used to report until about 2 years ago. So currently, if you were given a score, your average would be around 230, and standard deviation is 20. So one thing to know is that the pass-fail rates has been fluctuating a little bit over the last couple of years. So in 2020, depending on what type of student or IMG you were, it was 98, 95, 87. And then you can see it starts dropping a little bit in 2021, 96, 94, 82. And then last year, it dropped significantly. So you can see here for the MDs, 95 to 91%. First-time test takers, 96 to 93, and for everyone it was 88 to 82%. So this includes IMGs. Now you break out the IMGs, what you'll see is that international migrant graduates peaked at 87% in 2020, and then it dropped somewhat last year. You can see there was this peak here, and then dropped to 74% this past year, which equates the low, several years ago in 2018. So, there's been a lot of discussion about why that is. People feel like that there was some, it's possible that folks, misjudged the exam, didn't understand what it meant that it went pass-fail. That some folks might have eased up on it, even though it's still a really hard exam. Others feel that the pandemic and how it kind of moved the timing around, also threw students and IMGs off. So there are a number of theories about it, and it's actually discussed in this brick here called Assessing the Impact of Step 1 Going Pass-Fail. This is free. I'm going to ask Kat to drop that into the public chat for everyone, or if not, Louise can drop that link in as well. And you can read about the this whole situation. Feel free to share the brick around. It's free for everyone. So so do enjoy. All right. So I'm going to talk about looking forward a bit. Obviously, if you haven't taken the Step 2 CK, you will if you get past the Step 1, and of course you will. So there is this mnemonic called the roads to riches, and these just represent the specialties that are super competitive in the United States: radiation, oncology, radiology, radiation oncology, the surgical subs, so the 3 O's and U's, aesthetics, which is plastics, and dermatology. These specialties are overwhelmed with applications, so they have to use now the Step 2 CK as a screening criteria. And so once you get past the Step 1, then you're going to have to really think about getting the right score to be competitive, particularly you're an IMG. So let's now talk about study strategies. So the good news is that you have successfully taken standardized exams before, otherwise you would not be a medical student, or an IMG. So you already know what your learning preferences are, but there are strategies that factor in the subject itself, and then also your curriculum in terms of the strengths and weaknesses. And then also things you can do based on whether you have a little time, relative to the amount of concepts and domains you need to master, or a lot of time. The other thing is that there is some learning science that's emerged in the last 10 years about how you can better prepare. We'll talk about that a little later. So we'll talk. So with regards to some of these characteristics or factors, like for example, if it's microbiology and pharmacology, what's going on there is the framework for learning these and mastering these domains tends to be repetitive. So you can usually put those in a table structure, or you can put it on flashcards, where physiology tends to be more relationship oriented. So it's really about diagrams. And then, as I mentioned, if your curriculum is weak in a certain area, let's say micro, then you might have to go out and get some additional resources. All right. So now let's talk about an anatomy, and we'll go walk through all the various disciplines. So anatomy, is commonly thought of as gross anatomy, but that actually tends to be low yield. The anatomy that tends to be testable is anything that has clinical correlations or clinical relevance. So anatomy about specific disease. So the landmarks in, things like, appendicitis, traumatic injuries, and so forth. There are certain subsections that are, high yield, such as neuroanatomy, embryology, because the field there is fairly discrete relative to what's relevant for the USMLE Step 1. Now, on the exam, you will be, tested on anatomy, but you'll see it clinically. So you'll see anatomy in the form of X-rays, CTs, MRIs, also, with microhistology, with micrographs and photomicrographs. So be ready to, be able to identify the landmarks, clinically, and not just on a cadaver. All right, biochemistry is one of the crammable exams. I'm sorry, subject areas, because again, there tends to be a recurring framework for learning certain issues, particularly metabolism. So there you're dealing with substrates, key regulatory enzymes, which you start with, what you end up, and where does that pathway and start into another pathway. There are certain other conditions like vitamin deficiencies that are clinically relevant, so they're testable. So that's a little bit about the pathobiochemistry. Here you'll also learn about laboratory techniques that are clinically relevant, such as RT-PCR, ELISAs, and so forth, because they're used both in terms of how biomedical science is done, right? So you have to be able to interpret research papers, and then they're also used in laboratory medicine, right? To make diagnoses, like diagnose HIV or screen for other viral conditions, or figure out make a diagnosis of a leukemia by how you do the flow cytometry. Microbiology, immunology. So again, micro is crammable, but remember, it's not just bacteriology, it's all these other things: immunology, bioparasitology. So don't fixate just on bacteriology. Again, there's a recurring framework that they tend to test on, such as what is the laboratory, what are the characteristics in the laboratory, how do you make the diagnosis, where does it go, how does it get there, what are the vectors, what are the reservoirs, and also what are the treatments. On the immune response side, or on the immunology side, you need to understand how the immune response works in normal times in disease. Obviously in the age of COVID, it's very important to understand how vaccines work, the various types of vaccines, and and classical immunodeficiencies also gives you a sense of how how the immune system works, because it's often hey, you're missing such and such a B cells, or you're missing T cells, or you got dysfunction in your complement pathways, and then you'll get specific conditions because part of your your typical immune defenses are compromised. All right, pathology is a large part of the exam, and even if you're just trying to cruise by, you're still needing to focus on some of this. So here, what's going on is you want to focus on the primary presentation, particularly if it's a rare condition. So you're not going to see a ton of variation, but if it's a common disease, do obviously think about the variation. So, like for example, not all asthma is shortness of breath and wheezing. There is forms of asthma that just occur in patients, particularly younger patients, just as a chronic cough. So it may look like a cold, but it's asthma. And that's the other thing too. When you think about the clinical presentation, really think about how it can manifest as many diseases, right? So think about the many things that can start off as a cough, right? It could be it could be anywhere from a respiratory disease to a GI disorder to something infectious. So be able to really come up rapidly move through a differential diagnosis. All right. Now, they will often, provide information on age, gender, ethnicity, and there is a trend that where I think they are removing some of the stuff if it's not germane to the case. And that being said, just keep in mind that they're not trying to fool you with this. It is if they show you something, then it can come up. But remember that a lot of conditions are not pathognomonic, so it's not like, hey, anytime you have a black woman with a lung mass, that's always sarcoidosis. It could occur in a white male, for example. And so just because it's a white male shouldn't throw you off, right? In first aid, we've got mnemonics, we've got buzzwords, trigger words, and stuff like that. But on the exam, you got to know what the descriptions are, and they'll have kind of a clinical explanation. And if you do enough question bank, questions like R's or U or whatever, you'll start to see these common descriptions and get used to it. So you can pair it with the buzzwords, which helps with your memory palace. Now, most questions, that have clinical images, the good news is that you can probably answer from the history alone a lot of the time. So what I would normally advise is that you look at the images last. Try to figure it out without the image. You block put your hand up, block the image if you have to, and then work through the case. Then look at the image. And also because sometimes if you look at the image before you even look at the case, it's disorienting, right? And so, because you just don't have enough context. All right, next is pharmacology. Pharmacology, like biochemistry and micro, is crammable. And the reason is that it tends to focus on mechanism, toxicity. Used to focus on treatment as well too, but that's moving more to step 2. But you can think of class interactions and so forth. So those tend to be the recurring themes here. So if you're confident, you can just focus on the prototypic drugs. But if you know you gotta do better, or there's a concern that you might, there's a chance that you might not pass, then you want to go to, you might want to work through all the major variants. It's up to you whether you want to go to the minor derivatives or so forth. You can generally avoid, you don't need to learn the trade names, you do not need to learn the dosages. The trade names would only be helpful as a mnemonic, but it's not going to show up on the exam. These are the major categories: autonomic, CNS, antimicrobial, cardiovascular, and oncology. These are all covered at a very high level in first aid. And again, because this is often associated with therapeutics, make sure you tie it back to the pathophysiology, the microbiology. So again, try to create all those meaningful links. So this condition leads to this diagnosis, and then leads to this treatment. So try to work through that rubric, that framework of thinking. All right, physiology, as I mentioned earlier, is concept oriented, so it's not something that you can cram. It's really about relationships, so that's why I mentioned earlier the diagrams may be helpful, or mind maps. So again, when I say relationships, it's understanding like the things like the hypothalamic pituitary adrenal axis, things like that, and understanding what stimulates what part of the pathway and inhibits what parts of the pathway. And then you can also like the therapeutics, it's almost always, like I said, it's going to be in case-based vignettes and tied to pathology, pathophysiology, and so forth. All right, psychiatry includes, it's kind of a mix, includes psychology, sociology, psychopharmacology. So we kind of just mesh it together because they're somewhat loosely related. They are distinct fields, don't get me wrong, but they're easier to connect together. We tend to think about mood disorders, but there's all kinds of other things going on, like personality disorders, psychosomatic conditions, and so forth. And so these are all covered in first aid, again, at a high level. And then there's public health, and that includes classically biostats, epidemiology, ethics, and then more recently, it's about healthcare delivery, patient safety, quality improvement. There's a term called health system science that's there, and biostats, epi tends to be pretty high yield, and because again, it's a discrete area, and you'll often see in problem solving questions. And then over the last 4 or 5 years, that they've added more of these doctor-patient interactions where you have a scenario, a patient says something, or a family says something, or scenario happens, and then you have to reply back with a response. And it has to follow good principles of of patient interaction, ethics, and so forth. All right, great. So that was a quick walkthrough some of the major disciplines, and you can imagine it also ties to the organ systems as well too. Again, and also, by the way, don't worry if you didn't catch all that. There is a recorded version of this talk, as well as the PowerPoint is online. I'll show that to you a little later. All right, now let's talk about review resources. So there's a number of things out there you can use, and there's they've been around for some of them been around forever. So there are text reviews like First Aid. There are question banks like USMLE-Rx and UWorld. There are video resources. There are digital flashcard resources, review courses. There's and more of this stuff is obviously going digital these days. So the key thing is not that there's enough, but the problem is there's too much. So, and it all costs money. So what do you do? So we strongly recommend that you check out the latest reviews in First Aid for the USMLE Step 1. It's called Section 4, and there is the short version is in the book. If you go to our blog at firstaidteam.com, and I'll show that to you in just a little bit, it will you can get the fully expanded reviews there, and it's free on our blog. A couple of things, go ahead and get your resources early, whether it's an app or a book or a website or whatever, and then use it along with your coursework or your study, particularly with your coursework. You want to kind of integrate it with you. Try not to overbuy. That shouldn't be an issue because all these resources, even the books, are on demand. And don't blindly buy a whole series. Sometimes a resource is great in one area and not so great in others. So sometimes you do need to consider mix and matching. Again, the resource ratings and the reviews in First Aid will help you with making those decisions. All right, now I'm going to actually ask another question. Hopefully you folks are still awake. And so I want to hear about the types of resources that you're using or will use. It could be none of the above, or it could be all of the above. So check off all the ones that you plan to use or are using. So I'll give you folks a minute to answer the question. All right, so it looks like about a third of you have answered. So I'll give it a little longer because it looks like some of you folks are still thinking a bit. All right, more than half of you folks have answered, and I think we have enough. I'm going to go ahead and close the poll and share. All right, let's see. Okay, we are sharing the results. You can see that virtually everybody does Q banks, and then most people do videos and review books, and then you've got a fair number of folks that do flashcards and mobile apps. So so you can see a fair spread of resources, and you can see that almost everyone is using more than one resource. All right, let me go back to the presentation. So there are some general preparation study tips that have been helpful, that students have found helpful over the years. So one is, for example, develop a study schedule and stick with it. If Kat, Louise, if you can, we do have a link to our study planner. It can be found at our blog, so you can use that to prepare. It's completely free. The other thing to think about is, and you heard it earlier, which is you need to integrate everything you learn. These facts do not exist in a vacuum. They are linked together, and you gotta understand the logical framework of how you get from this concept to that concept, and that actually creates more durable memories. It actually beats cramming, all right? And then you need to be able to apply it repeatedly in case-based scenarios like Q banks. All right, and I mentioned earlier that there are these crammable subjects, and again, just to be clear, I don't think you should cram. I think you should try to master these concepts, particularly the clinically high yield ones for life, because it does have a direct impact on the future and the prognosis of your patients. But at the end, it is okay probably to cram in the week or two before the exam, just because you're just trying to sprint over the line, and then once over your line, then you can kind of rest up. You do want to focus on high yield materials over previously learned content, because you're just reactivating memories there. But again, just reapply. Don't just reread stuff. You have to actually do active recall, or what's called retrieval practice. Next, just make sure that you do not overschedule yourself. You are a human being. Most of us cannot do this consistently for more than 10, maybe 12 hours a day. So make sure you put in breaks, exercise, take a whole day off a week, just to get grounded, or just to keep you centered. And as I mentioned, always keep that attitude of staying focused but grounded throughout. And we do have a checklist that will help you pace you, and that checklist is in the book. It's right after all the acknowledgement stuff, like thank yous and the table of contents and stuff like that, and it's right before section 1. So check that out, and it'll kind of guide you through the major phases of preparing for the USMLE Step 1. All right, let's talk about test taking tips. All right, so or computer-based test taking. So that's what CBT stands for. So as I mentioned, download that module, do the module. It'll get you through it. Obviously, you should do the free 120, and we'll talk a little bit about that, and that'll get you familiar with the platform. There are some keyboard shortcuts. Most people don't use it, but I'd point out for the handful of folks that like to use the keyboards, and also for accessibility issues. And then lastly, it's I think we all understand you need to be doing questions throughout and at the end, and there's a lot of great science there. This was published 10 years ago, even 12 years ago, in the journal Science, where they showed that if you test yourself, and that's called retrieval practice. So you can either test yourself by doing Q banks or flashcards or anything like that, that you do better on the exam than with any other method of study, whether it's just repeatedly cramming it or just studying it once, or diagramming stuff out, that concept mapping. And it didn't matter whether these were straightforward, simple questions or more complex inferential questions, you still did better with retrieval practice or self-testing. All right, so let's talk about testing options, right? So there's a number of things that are out there. So first of all, as I mentioned, there's the USMLE sample test. We call it the free 120. They have updated some of the items, so it's a little more current. That being said, it's mostly helpful for format familiarity. Then comes the NBME CBSSA. So that's the Comprehensive Basic Science Self-Assessment. There's about 6-7 forms out there. You know, they're about 50 to 60 bucks. You can use them for a couple of months, and then when you're done, and it gives it to you kind of in test mode. When you're done, then it gives you an estimate of what of your probability of passing versus failing. And then lastly, there are Q banks like USMLE-Rx, UR, and so forth, and it's helpful for practice, study, and simulation. And it gives you a sense of, you know, how you do on testing. So for us, you know, we will give you your hypothetical score as well too. You know, while it is helpful to know whether you have a high risk or low risk of failing, you know, having a hypothetical number we think still is very helpful because that's kind of easier to key on versus low versus high risk. You know, where I think students kind of get lost. And international grads can get lost about how close they are to that danger zone, right? All right, now I'm going to talk about learning research. So I mentioned that earlier. There's been a lot of learning research that's emerged in the last 10 years. So what we've seen is that certain things are superior to other learning resources. For example, question banks are more effective than flashcards. That is not a hard stretch, right? Because why? Because question banks act like the real thing, and flashcards do not. The other thing is, how many questions should you do? And if this was a scored exam, you have to do about 300 questions to 450 questions to get 1 extra point in the exam. And most people do better if they do at least 3,000 questions. So, I would say, over time, over a period of year plus, you need to be doing at least, I say, 3,000 plus questions. It's also important that you do unique questions. In the studies where they were able to get to a number, it was based on the number of unique questions, not repeated questions. And yes, you may hear from other students or IMGs, hey, just do a question back 3 times and you're fine. The problem there is that when you are repeating a multiple choice question, you can trick yourself into thinking you know more when all you're really getting is the familiarity. We also call it fluency. The unique multiple choice questions always keeps you off your toe because you've never seen them before. You don't have the advantage of familiarity. And yeah, I know it feels tougher to always be doing unique questions, but that's how you get better. It's the same phenomenon with exercise, right? When you're exercising, it may not feel good in the moment, but when you look down 3 months the road and look back at where you were 3 months ago, you'll either be bulked up or you're going to be slimmer or whatever. So it's kind of like the no pain, no gain, with regards to learning. Then lastly, again, this is research that we didn't do, somebody else did it, so there's no conflict here. Students who actively learn first aid 3 times or more did better than those that did not. And when I say active learning, it's not just skimming through first aid or highlighting first aid. You're actually applying first aid. So for example, if you use our USMLE-Rx flashcards, which are key to first aid, then you can get through, if you do all 15,000 flashcards, you'll get through first aid multiple times. Because every time you do a flashcard and you look at the response, it's key to first aid. So you can kind of see where that fact fits into first aid and quickly address any weaknesses directly within first aid. So that's an active way of learning first aid. All right, on test day, you'll want to make sure that you don't overdo the coffee. That happens a lot. We get really psyched up. You will be in a office building. It tends to be cold. A lot of them tends to be cold. So come in with layered clothing so you can adjust it, whether it's cold or hot. As I mentioned, we do these question dissection labs, and a bunch of them are recorded. Just go to our blog or go to our YouTube channel to find them. But one of the things that we advocate for, particularly if it's a big question, is that you should read the lead-in first before you look at the rest of the question. The lead-in, which is, hey, what's the most likely diagnosis, or what's the underlying mechanism? That's what you're trying to solve for, and then you can go back into the case to look for the clues to put together the picture, right? And in a way that tests your critical thinking. So the exam again is 40 questions per block, so that's 90 seconds per per question. Yeah, I would say the majority of the time you should managing the clock shouldn't be too much of an issue, but but what we strongly recommend is that you commit to an answer within 75 seconds. And at 75 seconds or 70 seconds, even if you don't have the answer, take your best guess. And if you think it's solvable, you can mark it and come back. Just make sure you don't do more than 10, 12, because you won't have enough time. Because what happens is if you do commit to max 75 seconds per question, when you get to the end, you'll have 10 minutes left over, and then you can go back to try to solve solve some of the questions where you were able to narrow down to 2 options, but not down to 1 option. So that's how I would manage the clock. Now, there is a myth that you should never second guess yourself, and actually that's not true. People who actually second guess themselves, on average, do a little better. So so their second attempt, if they put down A and they come back and really think it through, it's like, oh, you know what, it's probably B. More times than not, they're actually right. And as you know, in our question bank and other question banks, you can see, if you're flipping from wrong to right or right to wrong, that type of stuff. Now, as I mentioned earlier, you can take a break between any of the blocks because you've got some break time. And most people will go a couple blocks and take a snack, a couple blocks, take a snack. Some will go several blocks and have a light lunch. It's totally up to you. And one way to figure out what your energy level is, how you want to pace yourself, is you can do a full day simulation using USMLE-Rx, and then that will allow you to figure out how you want to schedule in your breaks based on your energy level, because you want to, for example, take a break or go get lunch when your energy level is getting low. Lastly, we have this joke in med school called the C reflex. So we do have these nerve fiber called C fibers. So and the joke and the premise is that there are going to be some times where you will run into a question and you have no idea what's going on. Now, so the idea is that you should have a favorite go-to answer, B, C, whatever. Don't overthink it. Just click C and move on. The idea is, as soon as you realize that this question is completely unsolvable, you don't know what's going on, there's no way you can rule out any of the distractors, so it's really a blind guess, then you might as well just guess and move on. And the key thing is what you're trying to do is you're trying to save time, right? So again, remember 90 seconds per question, and within 30 seconds you say, you know what, I have no idea what's going on, and I'll never go figure it out, even if I was given an hour. If you do that, then you save 60 seconds, and you can apply that towards a question you can solve, right? So use that C reflex. Also keep in mind that there's a fair number of questions, sometimes dozens of questions, within a block that are experimental questions or calibration questions, so they're not going to count. They're there for other reasons. Okay. All right. So we're at the end of our talk. Hopefully you got a lot out of it. We're on social media in a lot of different places. So on Facebook, we got a blog, Twitter, Insta, TikTok, YouTube.